I'm Ryan Rother of Rother Dental and Rother Aesthetics and Wellness, both of the Verber Dental Group located in central Pennsylvania. The series of next videos that you're about to see are really just to teach you a little bit more about Invisalign. We want you to know the ins and the outs prior to your consultation so you're ready to go for treatment the day that we see you. All right, so it's time for your Invisalign consult. You're in the chair, what happens next? First, of course, you've already met one of our assistants, and what's really important too is that we make sure that one, dentally you're a good patient for Invisalign, as well as medically okay. So we'll review some things about your prior dental treatments, certainly a medical history review as well. From there, we're just gonna start to get to know you. We wanna know why you're here. Why are you interested in Invisalign? What are your goals? Your goals, in my opinion, are truly the most important part of your Invisalign treatment. We wanna know, are you interested in aesthetics? Is this more of a functional treatment? What do you know about Invisalign? Who has had Invisalign that you know that you're familiar with some of the treatments? From there, we need to gather records. We need to get all the information together to then create a treatment plan for you. We need to understand what are the limitations. We need to understand what the treatment's gonna look like for you going forward. And we have to do that through obtaining records. Records are gonna include pictures. So we're gonna take a whole series of pictures that we can then start helping us understand the diagnostic process to again see if your goals can match the treatment outcomes. Radiographically, we will also be taking a series of radiographs that too will help us understand, are there any steps that we have to take to go back first before we can go forward? For example, patients that may have an infection in a tooth, or patients that have a broken tooth, or patients that have a cavity, those things need to be fixed prior to starting Invisalign treatment. Other records that we're going to be taking while you're in the chair for the consult are going to be a digital impression. A digital impression is going to really help us then start understanding what an outcome could look like for you, and also help educate you as well as to where you currently are with your dentition or your teeth, and where we can go then to with your treatment. So a consult will include pictures, it's going to include radiographs, as well as then the digital scan. So let's get to know the iTero a little bit better. The impression itself will take maybe about 2 or 3 minutes at most. We'll then process the scan. So from all the pictures that are taken with the iTero, here's the iTero itself, as in the camera. This is the head of the camera that will then walk around the teeth. It'll actually then be taking the pictures. The pictures then will process into what will look like your mouth, just in a then computer simulation. So what we love about it is that we can show patients where they are, where they could potentially be then with their treatment. What's great is that we can zoom in, we can look at different teeth, we can look at wear patterns on patients' teeth. We can help them understand that yes, Invisalign is an aesthetic treatment, but it's also a very functional treatment. We can look at where recession is. We can take what are called wellness scans, where we can see how patients are tracking, not just in their Invisalign treatment, but also with their other teeth over time if teeth continue to wear or break down. We can then look at other things. We can look at then where potential treatment modalities are going to have to be done, where attachments may have to go, or something called interproximal reduction, which we'll certainly cover in a little bit too. But our favorite thing is that it just helps us look at what the expected outcome could potentially be. So during our consult, we're going to start understanding where you currently are. What is the diagnosis? What is the classification of your occlusion? What we can do to help going forward could potentially then be an outcome that would look like this. And does this then meet your goals? If it meets your goals and everything else aligns, then great. It sounds like we can proceed ahead with treatment. Something that I do think is very important to mention is that with all these records, with the pictures, the radiographs, and the scans, and understanding your goals, we will then upload all of this to Invisalign and make a customized treatment plan for you. What you see in the anticipated outcome isn't monitored, we'll say, by us. It's just a computer outcome. One thing that we pride ourselves on very much is that we're going to tailor, we're going to customize your treatment plan to you. We're going to spend hours going back and forth with Invisalign, making sure that what you're looking for out of your treatment is what we're able to deliver to you.